and Twyla Dillon, one of our senior analysts who works pretty heavily with our Medicaid data. So I'm going to do, Betsy, kind of to your point, kind of a high-level walkthrough. And if we've got more specific questions or folks want to see something, I may switch the controls over to John or Twyla and let them take it away. Does that sound reasonable?
Sounds good.
Okay. What you're seeing here is just sort of the initial landing page of the CLMHD Behavioral Health Portal. And I think what you can see is obviously this is a work in progress where you've got kind of a combination of the darker cells or squares are areas where driven by the requirements outlined by the data work group. And I'll back up for a minute just to say that the data work group is comprised of representatives from New York State Office of Mental Health. So we've got Jeremy Darman from the Planning Group, New York State OASIS, OPWDD, and several county representatives. And it's really that data work group that laid out the initial kind of requirements for this portal, which is still really, sort of, kind of in development. But that group took a step back and said, what are the kind of data we need easier access to, both county specific, but with an eye toward looking at things on a regional basis and identifying things like we want to know how many folks might be in need of service. We want to have a better understanding of, what kind of services folks are using within the behavioral health system. We want to look at acute services. So as we walk through each of these categories, it was really, kind of the initial, some of the initial areas where folks thought, having ready access to data would be most helpful.
And the other thing, Amy Button, could I ask you a question?
Yeah, you bet.
So this is publicly, all of this is on your public website?
This is on the Conference of Local Mental Hygiene Directors website and it's accessed via a membership login.
Got it.
And none of the data, it's a great point, none of the data is client level, so it's no protected health information. And as you'll see, the lion's share of the data that is served up in this portal is actually available in some fashion, someplace else, but just not necessarily readily queryable or accessible. So, sort of for this initial phase of development, I think the data work group really felt like there would be a whole lot of benefit in basically scooping up data that's relevant to system monitoring, oversight, and planning that may live somewhere else in some other sort of in some other website, but basically bringing it into a framework that was, sort of organized in a way to really promote system oversight and planning. So there's not a lot of new data so far that have been generated. And Betsy, I don't know if there's anything you want to add there.
Just the initial dashboard, which was version 1, was stood up last year to help with local services planning. And as discussions around the RPCs and moving towards that, this is the second iteration of the portal. It went from a dashboard to a portal, and CCSI, and Ann will show you, has done a tremendous amount of work to take it from a local services planning tool to something that can be used both for local services planning but also for the RPCs. So a lot of the work that was done between the dashboard iteration 1 and the portal, what you'll be looking at today, is to serve two purposes, because right now we're in the local service planning. And we're going to be launching it for the RPCs, and some work that's going to happen, probably currently happening right now, is each individual will have their own username and password. So it's some security pieces on it for monitoring, and so we can track who's using it and how.
Mm-hmm. That's a great point. I mean, I think what you're looking at here reflects the most recent data update, but really, sort of in parallel with that process, there's work that's going on right now to, sort of, sort of enhance the security and administration so that you can have individual user logins, but really with the idea that, that those logins could obviously be role-based and, sort of differently permissioned. So as different data are added to the portal, to the extent that that information might need to be restricted to certain user groups, we're kind of building out the administrative capability to do that, which will be available, later this spring. We've also, we're also doing a fair amount to just improve the overall look and feel and kind of end user functionality. So I think, as we thought about the priorities associated with the project, I think the first job was to, sort of populate the areas of greatest interest with the data. I think as we've been able to do that in this, we've had folks who've gotten some track record of actually using the data. We've identified a number of things that we think can work a little more seamlessly, some end user improvements. So those are going on as well. But if we were to just kind of orient you to the overall portal, the cells that are kind of in the darker color are the cells that actually have data in it at this point. So what I'll do is I'll kind of walk you through each of these cells and just give you an overview as to, sort of what kind of data you'll find there right now. So the first bucket really looks at data that might be helpful to a county or to a region in describing the level of need within that area. And the data source that I'm bringing up first is actually data that was generated by research staff at New York State OASIS, and it's really based on the National Survey on Drug Use and Health. So they've basically taken that national survey. The researchers at OASIS have worked closely with the folks at SAMHSA to basically look at those regional rates and then apply them to the population within each county so that they were basically, kind of adjusted to reflect what what they think would be sort of applicable to that county based on that county's demographic characteristics. So they've taken those survey data and applied it first to 2011 population estimates and more recently to 2012. And then based on some input from both the staff at OASIS and members of the data work group, they looked at that national survey on drug use and pulled out the specific items that they thought would be most useful to support planning. So what you see here is it kind of brings you into a view that, just describes, what's the general indicator, what does it measure, a little bit of context as to, sort of why it's important. And for each of the measures available through the survey, you'll see the data, the estimates as applied to 2011, 2012, broken down by age group. The default view in this is to Albany County, but if I wanted to go in and I wanted to look at that information for two counties, maybe side by side, I could kind of adjust my view to look at that side by side comparison. If I decided I didn't want to necessarily look at only one county, but I wanted to look at maybe the region because I was doing some regional planning, I could identify the region of interest. Within that region, sort of it would give me the counties that comprise that region. I could take all of those counties if I wanted to, or I could go in and I could subset my counties. And then what it would really let you know is the survey results for those metrics by age group for those 2 points in time. And I'll stop there for a minute and see if folks have questions. All right. Then I'm going to take us back to the landing page and look at the other, sort of measure of estimated need. And these data actually come from Salient Technologies' No PHI Medicaid product, which really includes fee-for-service and encounter activity on a statewide basis, but sort of aggregated to the level such that sort of you can't drill to the level where protected health information would be exposed. And what this view of data shows is it looks at individuals who a county or a region might determine as being in potential need of service, really based on their prior pattern of service utilization. So within the salient data system, there's an indicator called the behavioral health indicator. There's also a similar indicator called the OPWDD indicator. And it basically just looks at prior claims activity based on the type of provider that delivered the service, the procedure, the diagnosis, the drug code, or kind of the types of treatment that's provided, and has identified sort of a pretty broad definition of behavioral health indicator, similar process on the OPWDD side. So they really identify how many folks over the last 5 years have had any type of service paid for by Medicaid that falls within that category. And then within that group, this view of data, if I were Albany County, for example, it would tell me, so for my most recent calendar year, I've got 36,000 folks within my county that have had some sort of previous encounter with the behavioral health system based on that fairly broad definition, 2,400 who have had an encounter, sort of with the DD system, again, all paid for by Medicaid, and then provide some basic descriptive information about that population. What do they look like in terms of their age group? What do they look like in terms of race, ethnicity? And then what does the population look like? I was thinking I was looking at gender, but I don't see that. Oh, yeah, gender up top. So just, a kind of a pretty big cut on, sort of how many folks there are and their basic demographic characteristics. And it would let, sort of county users look at it for an individual county, but like, sort of the same basic navigation convention is in the prior screens. You could look at that information on a regional basis. You could look at it for a combination of counties that, that might be a sub-region, but just gives folks some basic descriptive information. Questions on that point? The next area is sort of takes a little bit of a further cut in, and again, using data from the salient system, this actually looks at the number of individuals who actually used services, both within the behavioral health category or developmental disability area, organized by service type. And what this view that you're going to see in a minute is based on the most recent full year of Medicaid data available, which is 2013. So in this case, what we'll look at is we'll look at the number of unique individuals who received some type of, sort of mental health, developmental disability, substance abuse disorder, emergency room and the like. How many folks actually received services during the most recent calendar year, and what did they receive? So if I looked at, in Albany County, and I looked at my 34,000 folks who have had some type of behavioral health service, the next view of data would look at the the specific number of individuals who received services in calendar year 2013, for example. So if I were to click on that cell and just sort of roll my cursor down, it would tell me I had 2,900 folks who had some type of mental health service, either fee-for-service or encounter, and then this will give you a more specific, sort of breakdown of the type of service received. How many folks received inpatient care? How many folks were seen in the CPAP, residential treatment facility, and the like. So same basic process if I wanted to drill into my OPWDD line as well as my substance use disorder line. And probably helpful to take a minute to just share that we worked pretty closely with the team at Salient Technologies as we developed these categories and the corresponding rate codes or encounters to make sure that, sort of we ran the data but then also had them validate the results so that we're, kind of counting things the same way as we know some of these data are being used to support other initiatives.
Question, Anne, Amy again. Is the data by county of residence or county of whatever you call it?
This one is the county of fiscal responsibility for the individual, which usually is residence, but you could have somebody who might temporarily be somewhere else but be, sort of paid for by that county. As far as the navigation, there, it's all about, sort of gives folks the same capability. You can, your simplest view is looking at a single county. If you want to create a regional view, you can, select that option. Or if you're doing some maybe sort of planning or system development work with maybe a neighboring county, you can kind of create a sub-region, maybe based on naturally occurring patterns of care or whatever that would really correspond to what you want to know. Maybe what I'll do after we kind of get through what's in each of the buckets, I'll turn it over quickly to Twyla, who can give you a quick demo, to show, okay, if I've constructed this data view that I think is helpful, if I want to maybe do some additional data manipulation, how do I export that data into a package that I want to work with, or how do I maybe print what's on my screen in a way that is, kind of user-friendly and something that I can, share with a colleague. The tab here is data that hasn't yet been updated, but it's an initial feed of data that comes from the Spark system. So that was developed to really provide counties with an understanding of, sort of the first set of data that we looked at relative to service use was really restricted to Medicaid only. That's obviously what the salient data has for us. If a county's interested in having something that might be kind of all payer, and in this case really, sort of the focus was on better understanding the folks who are using inpatient care, what this view of data looks at individuals who were hospitalized, and in this case I just I pulled up the most recent year of data we have populated so far is through 2012, but this will look at anyone in Monroe County who had an inpatient event for any reason, but then looks at, for those admissions, so if we look at those 69,000 admissions that occurred sort of for Monroe County residents for that year, how many of those admissions were for individuals that had either an active diagnosis or a history of diagnosis of some combination of substance abuse or mental illness. So it was just a, sort of intended to provide counties with a handle on, kind of the extent to which individuals with mental illness were being seen on an inpatient setting, whether or not that inpatient event was specifically tied to their mental illness. Questions there. The next couple views, which I won't necessarily go into, look at that same view of data, breaking it down by payer source, as well as looking at the number of admissions for individuals who've got multiple chronic conditions. And again, it was just to provide some data to folks who are doing planning predominantly on the behavioral health side to really understand, sort of the proportion of inpatient activity that was really happening within their behavioral health service recipients. The next cell looks at data that might be helpful to counties in understanding how many individuals within their area are homeless. That's another area focus for the data work group. In this case, the data are organized a little differently. The unit of analysis isn't county, but it's actually continuum of care. And this is one of those examples where it's really not any new data collection. What we've basically done is just brought in the PDF-based survey results that are available to counties on the HUD website. And the data, are derived from a point-in-time estimate that every continuum of care is required to do in January, where they go out and they just do kind of that snapshot of how many individuals in our area are homeless. And those data are reported to HUD, they're analyzed, processed, and reported, but they're reported and posted in PDF format. And I think the feedback we got from the, was that it would be helpful to have that information, in a way that was a little bit more accessible. So this really just shows kind of the default view as to the, the Rochester area continuum of care, which covers the city of Rochester and Monroe County. And it really just allows folks to look at the number of homeless households by household type, using, looking at the 3 most recent years of data, 2012 through 2014. The next chunk looks at the number of individuals that really sort of are within each of those households. And then the bottom pane really looks at some specific counts for, particular subgroups of interest. So in that, sort of point in time snapshot, how many of those individuals were described as being chronically homeless? How many had severe mental illness? So it really just, sort of puts those data at the fingertips of the county director of community service, their planning staff, so that they can look at, are we seeing increases or decreases? You can look at one continuum compared to another if you were going to do some regional planning, but just kind of gives you a little easier way to access that data. Similarly, we've pulled in some data from some county-specific juvenile justice profiles, which were actually created for each county and available on the division of the DCJS website. What we've done is we've basically pulled some of those data elements out to make them just a little easier for counties to have access to, and to track some of the things that they may be particularly interested in. So if we were to look, and it's basically the same kind of default view where you get to say, here's the county I'm interested in, here's the year I'm interested in. This one basically shows disparity rates and relative index rates, really designed to look at the extent to which minority youth are either more likely to be processed or more likely to be detained relative to white youth. And this was a statistic that members of the Mental Hygiene Planning Committee thought would be really helpful to both be able to access fairly quickly, but also be able to look at on a comparative basis. The last category of data is data that really comes from the performance reports that several folks on the call I'm sure are going to be familiar with, that were generated by the Office of Mental Health to provide a way to look at the performance of the behavioral health organization. So what you get when you click into that cell is the ability to get linked right to the OMH website where these performance reports are available. So if I wanted to see the full report, I would just go to that link. In this case, I've selected the report for the Western region. And what it does is it gives me some good background around those performance metrics, helps me understand those, those metrics by domain, the specific metric name. If I go deeper into the document, it gives me the specific metric definition, and it really lets me look at that information sort of for inpatient providers within the Western region. So if I want to, this is data that's helpful if folks want to track performance on those metrics and be able to look at individual provider performance. So if we were to look at a measure that was of particular interest to the data work group, they were kind of focused on continuity of care. Again, in this cell of the portal, we're looking at data that might be helpful in describing how we're doing in transition from inpatient to outpatient care. So what this view will show you is if I'm looking at the percentage of discharges followed by an outpatient visit for mental health treatment within 7 days or within 30 days of discharge. And if I, for example, am in Monroe County and want to know how my inpatient providers in Monroe County are doing on that dimension, this allows me to really look at that particular measure over time for the inpatient providers in my area. We've given, again, just really taking, kind of the data that has been published to that website and making it just a little bit more queryable if I wanted to focus in on, maybe I don't want to look at all age groups, but maybe my area of focus is specifically on my adult population. It'll let me sort of narrow my view in a little bit. If I wanted to select just one provider and look at their performance on that dimension over time, it would allow me to do that. if I wanted to then take the data and export it or share it in PDF format, I could do that right from this workspace. The other, the other cells in this area really follow the same basic strategy. The next one looks at engagement in care, so looking at not only did folks get to that first outpatient mental health visit, but were they seen 2 or more times in an outpatient setting within 30 days following their discharge. There's also a metric relative to medication compliance that folks were interested in seeing. So that's really what is in that part of the workbook.
Amy again. So this section we're looking at now is all BHO1 data?
It's all data from the BHO. It's basically taking the data that is summarized in those PDF reports, right, and just pulling out, the data elements that the data work group was more specifically interested in.
Yeah.
So
thank you.
And I think that was, at least one of the overlying principles for the, sort of this first iteration of portal development is, there is a fair amount of information out there that folks thought would be really helpful in understanding how a region is performing, understanding how a county is performing, but it wasn't, all in one place, and it wasn't readily accessible using, kind of a common navigation framework. So a lot of this is really, maybe just organizing, the good information that's already out there and putting into a context that made sense for folks who are doing that system planning, monitoring work.
Yeah.
What else is helpful to see? I'm going to take us back. I somehow minimized my landing page, so I'm going to go back. I'm going to pop us back in. But are there questions folks have? Betsy, I don't know if there's any more context that you might want to offer.
Not really. I mean, I think that, we wanted to show you what we had built to date, what our plans are for additions to the portal. And I think that as we discuss what you'll be collecting from the plans, our intent is to obviously create additional boxes and to have that information, added to this portal.
Did you talk about the inpatient-outpatient transitions box?
The inpatient-outpatient transitions, that was the data right now where we thought the BHO data is probably the best available kind of consistent resource for that. So okay, some of the measures of continuity, engagement, I think over time, to the extent that there might be other metrics available, they could certainly be kind of loaded into that area. And I think Betsy made a good point in that this initial framework, came from what folks who are doing that systems planning and monitoring thought would be really important to have visibility over, maybe 18 or 24 months ago. So, I think that work group is now coming back and looking at, sort of what are the most important things to have access to now, and, some of the things that, some of these unpopulated boxes might be sort of either, sort of fine-tuned a little bit, or there might be other areas of impact that, we identify.
Wow. So what are the data sources for these sort of up-and-coming light blue boxes?
I mean, that's exactly what we want to be looking at. Like, for example, on the employment site, we had a good demonstration a couple of weeks ago of the NICE system. So, I think the question is, wow, are there county-level data, sort of associated with that system that would be helpful? I think the idea down the line is that you might be able to set up a structure that could include data that are sort of publicly available, or maybe not publicly available, but could be sort of appropriately accessed from other sources, but you might be able to supplement that with kind of locally or regionally derived data that might really support your planning and monitoring, and it might not necessarily be exactly the same for every region. So if one, sort of region had a particular area of focus, the ability to gather data that would provide them with some visibility over that metric, you could set up a process where they could upload that data, present it in their portal space for their region, and really be able to look at that element in the context of maybe some of these other. So I think, as Betsy mentioned, we've got a data work group that includes representatives from the 3 state agencies and several counties, and they're going to actually come back together tomorrow afternoon to do kind of the next round of planning to say, okay, now that we've, sort of populated these initial cells, now that we've got a little bit more of direct experience around what's helpful and maybe what is less helpful than we envisioned, what are the, next priorities, what are the things that are most important for us to know, and I think that'll cue up a, sort of the next, round of development. Is this, if this is what we want to know, what are the very best data sources to access, and then how, sort of what are the measures, and, how can we go about continuing to build it out. But I feel like it's very much a living resource as opposed to something that is, static in that way. I'm going to ask John or Twyla if there's anything that I should mention by way of background or any features that you think might be helpful to, sort of highlight that we haven't touched on. Okay. Oh, I mean, I don't know if, I don't know if the focus here is more on, sort of what's in it, but if we've got some tutorials that, it's for just to kind of help people in using the resource. So, a little quick, how to, export data. How do I, improve the way that the data look on my screen? Once I've got a report that I've developed, how do I print a copy of that in a way that I can share it with others? So we, sort of we've built out a few resources. We've got an FAQ sheet, and there's, we're, I think, continuing to, try and figure out how do we make this information most accessible to a pretty wide range of users that might be, varied in terms of their, kind of technical skills and comfort.
So what do people think of the portal?
Wow.
It's great.
Great. It's
Yeah.
Great.
Yeah.
We were trying to interpret that wow, like, wow, you've totally confused us, or...
Oh, I took it as a good
laugh. I was on the data committee in a previous life, and, this for me is just incredibly exciting.
Excellent.
Oh, good, good. I'm
Yeah.
glad.
No, it's wonderful. Do you have any interest in individual experience of care data? I mean, there's not a source for that currently, but
Oh, for sure.
Hi, hello. Hi, this is Tom Utara with RFMH, working for OMH and OASAS. This is a beautiful site, and I think you've got, a tremendous amount of useful information here. One of the things I was wondering, these reports or views are at a very high level. Have you considered the possibility of like a URL web technology type drill down to the individuals that are driving these metrics?